Hello and welcome to Clinical Exam Series with Dr. Piru. In this video, we are going to discuss clinical death. Death is inevitable in clinical practice. However, it is important as a clinician for you to recall that the primary cause of death is the malady that the patient is suffering from. The clinician and other health workers are only working to prolong the quality and the length of life. To make an assessment of clinical death, you are going to need your stethoscope and your pen touch. Death is defined as irreversible cessation in circulatory and respiratory function. It is important for you to know how to make this diagnosis, as this skill is going to be called upon in your clinical practice, legally, as well as in public settings. To make an assessment of clinical death, there are three main parameters that are assessed: the nervous system, the respiratory system, and the cardiovascular system. When we assess the nervous system of the patient, we assess the Glasgow Coma score of the patient, that is, the best verbal response, the best eye opening, and the best motor response of the patient. Here, it is going to be 3. Then we assess the brainstem reflexes, the most common of which is the pupillary light response. Here, the pupils are fixed and dilated. That is, they are dilated and unresponsive to light, both direct and consensual light reflexes. Next, we examine the respiratory system. Here, there are no respiratory efforts, and the breath sound on auscultation are absent. Next, we examine the cardiovascular system, the peripheral pulses, the central pulses, and the heart sound. Both peripheral and central pulses are not palpable, and the heart sound is absent. It is important to auscultate for a full minute, as certain drugs and poisons can drastically reduce the heart rate. If all these examination findings are absent or negative, then we make an assessment of clinical death, and we go ahead to carry out the most difficult task of most clinicians, which is to break the bad news.